Hi, my name is Warren Carell. I live in Toronto, Canada, and I'm making this video about my ablation procedure that I had at Sunnybrook Sciences Center in March of 2013. In April 2012, I was diagnosed with intermittent atrial fibrillation. And prior to this diagnosis, I was having some occasional, episodes, heart rate episodes, which I would feel my heart rate beating very, very fast. And I kind of dismissed it just as being out of shape or, something strange. I didn't think it was an actual problem with my heart. I thought I had a very healthy heart. So as these heart episodes, or these rapid heart rate episodes, increased, I finally went into the emergency room at Toronto East General Hospital, and when they took my heart rate just at check-in, my heart rate was over 200 beats per minute, and obviously I was admitted very quickly, and within a few hours they had determined what I was having, that they called it AFIB. I was released about 5 hours later. They gave me some different medications to take, and then I went and saw my family doctor, who happened to be on vacation, and they gave me another doctor to talk to at my family clinic, and it turned out she had the same thing, and she had a ablation procedure on her heart earlier that year. So she was a great doctor to talk to about my heart condition. Anyway, over the next few months, I was referred to Dr. Sheldon Singh at Sunnybrook. Dr. Singh started running me through a bunch of tests. They did a stress test on my heart. They did a bunch of Holter monitor tests. I think I had 4 one-week Holter monitor tests over the course of 5 or 6 months. And then I had, what else did I have? I had heart imaging tests done. So I had echocardiograms and a few other things. Anyway, over the course of those 4 months, oh, and by the way, when you get your Holter monitor test, as for men, I would just suggest that you shave your chest hair. It's a lot better that way. Just shave all the hair off. It doesn't make sense to keep any hair there. The equipment works a lot better that way. Anyway, I was also prescribed a bunch of different medications to try. We tried to deal with my atrial fibrillation using different medications. One of them was metoprolol, which is a beta blocker, I think it was. That was very bad. I'd used that medication for about a week, and I just had to go off it. It was very depressing. We tried something called diltiazem. It's a calcium channel blocker, which didn't seem to make any difference for me either. And then we tried a thing called flecainide, I think it's called flecainide, or pronounced flecainide, and that actually gave me some success, and that lasted only for about 2 weeks. So I was disappointed when it stopped having any impact. By the time I was done all the testing in December, we determined that I was a candidate for the ablation procedure, and we booked the procedure. The biggest holdup with Sunnybrook, or with this whole thing, was getting an MRI for my heart. And that took about 3.5 months. So I finally had the MRI booked on February 28th, 2013. Had the MRI done the next day on March 1st. I had a consult at Sunnybrook with the anesthesiologist, and then I had another test called a TEE, transesophageal echocardiogram, which they stick a long, rigid pole down your throat into your chest area to take a look at your heart to make sure there's no clots that are still in the chambers of any of your hearts. That is a very, very uncomfortable exam. they freeze you, and they also put you under a general anesthetic to try and relax you, or a light general anesthetic. But it was still very uncomfortable. It was probably the worst part of the whole procedure. Anyway, my procedure was then on Monday, March 4th, and over the course of the weekend I had to inject myself with some anti-clotting drugs to make sure no clots developed over the weekend in the chambers of my heart. And then on Monday, March 4th, I had the procedure at Sunnybrook. I went in at 7 a.m. first thing in the morning. All the staff were great. The heart area there, they were fantastic. They prepped me for the surgery. They had shaved the areas where the ablation equipment goes in, and they also inserted a catheter, which was, again, that was uncomfortable as well. But it was, I'm glad they did that. It was great. Not great having it done, but it was great that it was done, and I didn't have to get out of bed to go to the washroom. The operation lasted about 5 hours. The operating room was very interesting, lots of TV screens. It was very cold. But they put me under, and then when I woke up from surgery, I felt great. The procedure obviously went well. They let me out the next morning, the Tuesday morning, and they gave me a blood thinner called Xarelto, and I took Xarelto for 3 months after the surgery. Xarelto, one of the side effects of Xarelto is headaches, and I had a lot of headaches over those the first 6 weeks. Anyway, during my recovery time, my heart, every now and then my heart would skip a beat, or it would have like a 30 seconds of rapid heart rate. And I also noticed that my heart rate, everything I was doing, whether I was at rest or I was, playing any sports, my heart rate was beating at about 15 to 20 beats per minute higher than it was before the surgery. And over time that dropped down to about 10 beats per minute higher than it was before the surgery. Within 2 months it was down to about 10 beats per minute. And then now, this is August, my heart rate is completely back to normal. I have no skipped heart rates. I have nothing, like my heart is perfect again, like it was before the diagnosis. I've had a few Holter monitor tests. Everything came back normal. And anyway, it was very successful. I'm very happy that it only took one attempt for them to get this fixed. But like I say, it was great. Dr. Singh is just an excellent doctor. Everybody at Sunnybrook is just fantastic. That hospital is amazing. Every single person I dealt with there was great, very professional, knowledgeable, and basically very authentically interested in helping. Anyway, I hope this video helps. I watched a few other videos about the ablation procedure. I know it can be kind of intimidating or scary, but it's fantastic, and it's probably going to be the best thing you ever did, rather than being on drugs or medications the rest of your life. All right, thank you, and I'll hope you have a good experience.